We are programming something for you I don't think we've ever done before, and it's called the 4 Horsemen. Now, when I say 4 Horsemen, I'm not talking about the apocalypse. What I'm talking about is improving some of the big, long musculature that has a big impact on your pelvis. So these are the 4 kind of big pieces that I try to go after if people have low back pain or trying to address anterior pelvic tilt. Basically, these 4 muscles do a lot to drag the pelvis into extension. So the first one is rectus femoris, which goes from the pelvis to the knee, right? That's that head of the quadriceps that crosses. And so what ends up happening is we're gonna address that, doing some classic kind of long levers quad smashing, really going after and focusing on that tissue in the middle. The second piece is going after the iliacus, which is inside the pelvis. So it goes from pelvis to femur. Okay, that makes sense. So we look at all the systems. Femur, right, to pelvis, and then we have inside the pelvis to inside the femur. And that iliacus, man, it does a lot to make people feel a lot better. Then, of course, we've got psoas. So we're gonna go after the gut smash. And psoas goes from, wait for it, spine to femur. Okay, that makes sense. And then in the back, we've got the QL, which we'll address, which doesn't necessarily go from, it goes from the rib cage to the pelvis, but also does this. So all 4 of these muscles have the opportunity to drag us into some extension. So when we restore or get some input in this, it allows us to handle positions and have more choice where we can have better pelvic floor function, take better breath, be more midline, and we'll see that we stop being in this sort of vampire position where we're a little bit overextended. 4 Horsemen, enjoy. Simple quad smash should be a basis for a lot of your soft tissue work and home mobilization practice. A lot of times that the front of your thighs just become fibrotic and very stiff, and this can cause a whole lot of leakage of power and potential dysfunction upstream and downstream. So whether we're trying to improve downstream or the hip and low back or improve upstream from the kneecap is obviously a big deal. When we actually get into our work, you're going to either need a ball or a roller, and both of them should be fine. You can alternate back and forth. Now, something that's important is notice that I'm supporting myself on my other leg. That's to get my thigh even with the ground. So there's a lot we can do here, and the first thing we want to do is I'm just going to start in the middle of the thigh, and it may be that in 3 minutes time it's too difficult to get too much up and too much down. The whole thigh. So I'm either going to work up or down. Now, the first thing I want to do is make sure that I'm actually accepting the weight of my leg on there. So I'm going to stop, take a big breath, grab the glute and straighten the leg and flex the thigh for 4 seconds. And then I'm going to slowly exhale and see if I can relax in and actually have the femur make contact with the roller of the ball. That's what I'm trying to think of in my head. And if I am not able to completely relax and come off tension quickly, then I've found stiffness in the tissue that we think is less than advantageous. So most of us are running around with pretty stiff quadriceps. What we see is that typically people are just skimming the surface and not getting a lot of real work done. So without having gone anywhere, I've just go ahead and initiated a big contract relax cycle so I can make sure that I'm actually at the bottom. One of the great things about the roller is that I can add rotation in and scan side to side. And we prefer scanning side to side than rolling front to back. So work from inside the leg across that band. And if at any point you get stopped, drop in your contract relax, work onto the lateral or outside the band. And while we can't stretch or mobilize very effectively the IT band, we can improve how the musculature is inserting next to it. So right here I'm on the outside of my thigh. It's a little bit tender. I can modulate my pressure with my other leg and on my arms. I drop in a contract. I relax and see if I can sink all the way in. Again, a lot of times when we're seeing people with dysfunction around the knee or the hip, they really haven't done a good job. One of the good job of mobilizing their quadriceps, even though they think they have. One of the nice things about the roller, or roller with texture, is that this gives me, this rumble roller particularly gives me a little bit of an opportunity to scrub back and forth. So this is like taking layers of warm silk and trying to get them to slide over your steel springs. And what we're trying to see here is that if these tissues don't articulate well with their neighbors, then we have high resistance internally, which can lead to loss of efficiency. So you can see that without having to go very far, we've easily sucked in 2 minutes of time here. We're going to try to get 1 more minute. I'm just going to work down a little bit towards the knee. And again, start that whole process. Can I contract, hold and relax. That's sort of a lie detector test to see if I can get into the bottom and really relax around this, because that's really the goal, is to make sure that I can actually have my brain turn off the musculature here. And then simultaneously, while I'm keeping an eye on breathing, I can scan side to side, looking for stiffness. I can push and pull in a scrubbing fashion that fascia and those deeper layers, just making sure that they articulate and actually slide and can hydrate. And once I've scanned a section, have scrubbed a section, and I can easily contract, relax, and I make sure that I'm at the bottom, only then will I move on to the area. And the way to work around the quadriceps is to think, hey, I've only got to survive 3 minutes of this, so if I get some good work in, it will work through the entire system, and the next time I address my quadriceps, that will be sufficient. So 3 minutes pass, even if you haven't addressed a large area, still try to address some area. So in this time, I'll start a little bit lower, working down by the base of the knee. And again, one of the nice things about being able to support your weight here, if you're at home, you can actually lay on a pillow, is that I can make sure that I'm actually getting the full weight and that my leg can accept the full weight. So take a big breath in, I contract, I relax, and then I'm free to play. If I want to bend my leg and change the angle a little bit, I can. What's nice about this, though, this long lever or straight leg shape, gives us an opportunity to work on tissues sometimes that we want to be in these shortened ranges, but this long lever position really highlights specific dysfunctions. We have a short lever variation we call pain washing, but what I want to do is make sure that I'm, in fact, just addressing different aspects of my quads, and in this situation, it really does work best in this long lever shape. Leg underneath me allows me to support and modulate load, hold up the body with the rest. If you need to stack your head, feel free to knock yourself out. Keep an eye on your breathing, and if you scan side to side and you can't take your full weight on anything, by all means stop and contract, relax. If that's feeling good, move on up and just start that scanning process again. And if you get it to the outside and it feels a little bit tender, make sure that you actually can contract and relax to desensitize that, to tell your brain that's not a problem. And what's happening now is I had a good relax, but I'm not completely able to relax entirely, so I'll take another breath again. Engage the glute, flex the quadriceps, hold for 4 seconds, and then slowly exhale and see if you can relax all the way. And now I'm actually at the bottom of that well, and then I'm going to move on side to side, scanning in that half circle, and then make sure that I can actually scrub a little bit too. So it's easy to neglect your quadriceps because they are not fun to mobilize, and this is one of the reasons that we feel like a 3-minute effort per leg is really a reasonable amount of time to wrap your head around this intervention. So scanning side to side, looking. If I find something that feels stiff or restricted, or can't take my full weight on, or I stop breathing, I'll make sure I can squeeze my glutes, flex the quad, and relax into that. You can even do some scrubbing and come back to that contract, relax. But the bottom line is scan, scrub, and do that contract, relax, and make sure that you're doing the work on a smaller amount of tissue than trying to roll your entire leg musculature. So this is our basic quad smash with either a ball or a roller in that long lever, long leg position. When we're addressing health around the pelvis, and specifically one of the big powerful hip flexors, we have to talk about the iliacus. So if you have a bigger ball, this is a supernova, or even it could be something like a kettlebell handle, would be more aggressive. What we're gonna do is we're gonna lay on this thing and put it right inside the pelvis, inside the bone. So I've got right here, I'm laying on the spine of the pelvis, that would be my hip flexors. And what I'm gonna do is move to the top and then drop right off and sink in to the soft tissue muscle system that is that iliacus. So people like to talk about iliopsoas as a single complex, but psoas is a different mechanism entirely. So it goes from psoas goes from spine to femur, and iliacus goes from pelvis to femur. So they're very, very different in their mode of action and attachments, even though together they have similar functions. So notice that I can internally and externally rotate my leg. And what I want to do here is make sure that I am, at no point am I feeling, if I go really too far south towards my leg, I may get into a neurovascular bundle. And how would I know that? Because I would feel a pulsing, and it would feel not good. But what I can do here is pin this down, add some rotation, and then twist a little bit away. So all I'm going to try to do is get about 2 minutes per side. Big breath in. Make sure you can get to the bottom of the breath. And as you'll see, as you relax here, this is a powerful way of making people with low back pain, because it has this large extension moment on the spine. It's pulling the pelvis into extension or pulling the femur back. And it's part of the reason that we can see dysfunction around the hip. So it's rarely talked about, but a crucial component. And you'll see that as you internally, externally rotate the leg, you'll either tighten up that fascia or give that fascia some slack. The goal here is just to have a little dose and response. We feel like being able to address some of the powerful musculature on the inside of the pelvic bowl is often missed in the conversation. When we do after action reports on athletes who've had some kind of disruption or sports hernia, they see that they've never addressed pelvic floor or pelvic bowl kind of related issues. So being able to contract, relax, again, one of the ways that we can turn those musculatures back on and get them sort of reintegrated into the spinal stabilization movement system. So again, I find that hip, the high aspect of my hip, and then all I do is go a little bit above it and just in for starters. So I'm just going at the top of the bowl. I'm just feeling like I'm trying to sneak off. Giving this a second to make sure that I can actually breathe all the way in and all the way out. Otherwise, I'll hold some tone, but I'm trying to make sure that I can contract and then soften, exhale, and relax. And as I move that leg in and out, I can change the angle of attack. So I'm pushing on some of the abdominal musculature. If you think about the rectus abdominis, the six-pack, it's coming down the front of the abdominals, inserting into this common tendon that's inserting onto your pubic symphysis or the front of your pubic bone. Also, you have another muscle wrapping around the transverse abdominis, becoming superficial of the system and coming out here too. So as we tie into this system, what I'm really trying to do is address what's happening to the musculature inside the pelvic bowl here. And as I move towards my femur, you'll see that you'll capture aspects of the tissue system that really implicate sort of and can limit function around the pelvis and the hip. But understand that we are impacting the entire fascial structure system here. So while I may not be direct gut smashing, improving fascial quality, improving sliding surfaces, and function of the musculature and connective tissue right inside the pelvic bowl is a winner. Trying to get a couple minutes on both sides is a really nice entree in. This is a wonderful thing to do if you're feeling like you've got a tight hip or some function that's going strange in the low back. This often gets missed in the category of tissues that may be implicated in how my spine is functioning. The gut smash or abdominal mobilization is a crucial component to improving function of your trunk. One of the things what you like is that most of us have a roller at home, and this is a great piece to do post-training. Now, oftentimes we think we're just going after the quadriceps of the spine, which are the psoas musculatures or deep musculatures, but we're not. We're addressing how all of these layers are able to slide and twist and rotate and move. We've got internal, external obliques. We've got rectus abdominis. We have the bigger transverse abdominis. We're really thinking about how do these things work together as a system. So I'm going to use a roller to be able to access this. And what we're going to try to do is get about 6 minutes on the trunk. We also have an opportunity, if you wanted to make it a little bit more focused, as I'm laying on my stomach, to lay on a ball, and that will give you a little bit deeper and a slightly different iteration. So either one of them is effective, but I'm going to use a roller today. So what I'm going to do is I'm going to start at the base of my rib cage. And the key here, in time we're working on mobilizing the trunk, is to keep an eye on breath at the same time. So as I take a big breath in, I'm going to challenge those tissues under load and find resistance. And it's also vital that I'm looking at the end of the exhale so that I can actually deflate the trunk maximally and find out ranges of motion in the trunk as well. So as I inflate, I'm going to challenge position. As I deflate, I'm going to challenge position. So as I come around the end, notice that I can do things like push and pull. I can scrub back and forth. I can sear, kind of sink in. This is a comfortable position. And the idea here is to put yourself into a comfortable shape. But what's nice here is that as I start to add this contract relax concept, I take this big breath in, challenging those tissues. I'm going to flex my abs into the roller. And then as I exhale for a long period of time, I'm teaching myself to be able to relax and soften. And as much as we all want a rock hard six-pack, We also need that rock hard six-pack to completely be soft when it's time not to be a six-pack. We see people's over-tensioned abdominals don't function, so I can't twist, I can't flex, I can't bend very dynamically. So while I need to be able to stiffen instantaneously into a rock hard shape, an appropriate rock hard shape, I also need to be able to soften. So get to the bottom of your breath. And when you get all the way in, you might find you're uncomfortable there. And a lot of that is that your brain doesn't know how to register some of those positions and feelings. That's completely okay. So I can scrub back and forth. I can add a little bit of twist. You can roll in a leg down below. It's all going to be fair game. And the goal is just to keep playing with these positions. So I'm still at the bottom of the rib cage. And what I'm doing is I'm pulling off some of the skin and connective tissue around the bottom of the rib cage as it impacts now diaphragm and some of these, again, really big, powerful muscles of the obliques. So tacking it down and creating rotation and then adding some breath here to challenge that position, and then exhale, get to the bottom. This is part of our core plan for anyone who has low back pain. We can get you into a comfortable position. We can lay on a ball that maybe is smaller, doesn't maybe put your back into too much flexion or extension. We have a lot of ways to get this comfortable for you, but what we want to make sure is that you're doing this as a way of improving trunk function and also improving the way these muscles can even contract or relate to themselves. So as I move down now, I'm just off the ribs. I'm starting that same idea, rolling from side, rolling to the other side, taking a big breath in and contracting, relaxing, and really feeling comfortable about playing with position and depth and being okay with feeling a little bit strange, right? The questions always come up are, hey, is this going to injure me? And the answer is absolutely not. One of the things that we're seeing is that especially if we can contract and relax, we're teaching our bodies how to protect and manage spinal motion by encouraging correct abdominal kind of pressurization and stiffness. The other thing is that we're able to get some non-threatening input into the tissues around the spine, even restore blood flow to some of these critical aspects that sometimes get shut off when I'm in an acute bout of muscle pain or joint pain around the back. So big breath in and contract. We're teaching our abdominals how to fire again, how to get appropriately fire, or if I'm in tonic because I'm in fear mode, this is an easy way of helping to break that old cycle. So notice I just keep finding positions that are comfortable. I can roll side to side. Obliques are all fair game. So even if we're not addressing back pain, we should be rolling to improve trunk function. And those obliques are hard working monsters that transfer a lot of energy between the pelvis and the rib cage. So we have to look at this system. We talk about the spine being a huge kind of, the lumbar spine being really a transmission between upper body and lower body. And you have to look at the dynamicism of the musculature around the trunk to be able to handle these large loads and stiffen the trunk appropriately. So if my friends can easily squat 1,000 pounds and deadlift 900 pounds and higher, we have to say that, hey, those trunk muscles need to be able to be dynamic and to function well. So as I work my way down to the belly button, I'm also just rolling on my rectus abdominis. And if we think about the six-pack musculature, for example, one of the things that's amazing is that many of us train our abs every day because we want to have a six-pack, and yet we never mobilize our trunk musculature. So keep in mind that this is fair game, side to side. You could treat your rectus abdominis and six-pack musculature the same way you would treat your quadriceps or your calves after a run if they were sore, right? Most of the time when we do talk to people, hey, have you ever mobilized your trunk? They would say, I've never done that. And I say, what do you do when they're sore? And you eat some more ice cream or celebrate that your abs are actually sore from working out. So the goal here is to try to accumulate about 6 minutes of work. And if you don't cover the whole trunk, don't worry. This is a wonderful way also to turn your brain off and to help yourself relax after a stressed day. This has a large vagal nerve input and can cause a big parasympathetic shutdown. So again, the idea here is to have a dose and response, to have some input in to make it so that my abdominals can contract and my trunk can function more effectively, not to blow myself out. So if you're feeling good, have a dose and come back and remember that you can do this one tomorrow. This is a mobilization geared specifically trying to address your QL. Now, remember that we're trying to really look at the whole musculature and the whole fascial system of the spine. But this is a little bit different. We've got a bigger ball here. Instead of jamming the feet up on the wall to compress, we're actually going to let ourselves go into a little bit of extension. And the idea is, instead of kind of trying to press straight down, we're going to try to bend and bow and address some of this connective tissue and muscle system of the spine obliquely or from the side. So what I'm going to do is just get into a comfortable position here, and then I'm going to get the ball starting somewhere. So I'm going to start at the base of my spine, and then the magic here is being able to actually drape over the ball a little bit. So again, it's okay to be in this globally extended position. That's taking that tissue, and instead of lengthening, we're giving it a little bit of slack. So instead of addressing that tissue with the back flat, we're letting ourselves drop into extension. That is going to give me a little bit more play. And then what I'm going to try to do is trip over the ball. So instead of coming straight down, can I push in from the side? We're going to see if we can get 3 minutes of working on the side, just working slowly across. And as soon as I feel like I'm off that side mass, that sausage, I'll reset, come out again, just move the ball down a little bit. And again, first order of business is just to get comfortable on the side. Imagine I'm working in somewhere between where the musculature of the side of my pelvis and the side of my trunk is coming in and starting to address that big QL, that chondritis laborum. But we've also got sliding surfaces there, we've got deeper rectors, we're affecting the entire neighborhood. So I sink in, keeping an eye on my breathing. Can I take a big breath in, big breath out, and then I slowly just move that and try to push that thing, bend that muscle fiber bundle all the way over to the spine. And then when I feel like I'm rolled off it, I'll reset again. So this would feel like a great deep itch and a wonderful massage. You can adjust this so that you can be whatever feels appropriate. What I just don't want to do is come straight down. The idea here is to be able to attack these tissues, enter these tissues a little bit differently. So keeping on my breathing, making sure I have full access to my breathing on either side, and then just working across, and then just continuously and systematically working my way down to the base. And what will end up happening is I'm trying to, this 3 minutes in these kind of big swaths, address one section at a time and systematically work from the top of the QL region, the musculature of the back, the hamstrings of the low back, and work my way down to the bottom. And then once I've done a pass, if there was an area that I felt like, hey, could use a little bit more love, I can use the bonus or the balance of my few minutes here just to make sure that I'm coming back in. And once I've approximated just about 3 minutes of work, then we'll switch sides and hit the other side. So we're coming up on our 3 minute mark. And again, trying to move in from the side so that I'm addressing the obliques, I'm capturing some of this lateral musculature, and then just smearing that and pushing that all the way in. And then I'll move to the other side here, and we'll do the same thing. Get this. So starting up top, got about 3 minutes. And the first order of business here is just to relax, drop your legs to the side. So you can see one of the nice things about this is instead of this classic rotation, stretch, lumbar stretch that we're doing, we don't have to go very far before we start to impact the tissues, some of the tissues we're maybe trying to change in this position. So I don't have to get this really radical stretch. I'm just putting a load and then taking the tissues and asking them to twist and rotate. So this is an easy way of getting a little bit of that motion and also biasing some of the complex spinal movements that we tend to see in actual sport and actual movements where the spine isn't so formally stiff and rigid. So here I've got extension, I've got some rotation. It gives me access to these positions of my spine. Working on breathing and then smearing over, trying to push through that low back mass as I get back to my spine, and it feels great in there. And I can stop and drop in a contract, relax at any time. So big breath in. I can contract and flex into the ball and relax. And as always, with any of the caveats of working on your low back, remember that if you're planning on standing up and being radically dynamic, our best recommendation is, hey, this is a great thing to do afterwards. Don't necessarily want to mobilize the tissues of your spine and stabilizing, just in case that might affect your ability to create force or have control. Any soft tissue work that we're doing for a short duration of time is very safe. And so if you find you've gone to the gym and you're feeling very stiff,
this can be a wonderful way to wake up your back. So don't be afraid, but if you're going to really camp out and address these tissues, then what we recommend is do this as a finisher. But you'll know what is going to make you feel good, and there's plenty of times before you want to jump in there and go hard, where you just need to spend a few minutes prepping and getting some non-threatening input into your body and restoring sliding surfaces. So that's the best way to use it afterwards, but if a few minutes of targeted QL work beforehand will be fine. And I'm working my way down to the bottom, and I'm just snug in there, and the idea really is to try to keep coming in from the side and then run into that mass of musculature on your low back. Pause for a second, and then just work that way over. And again, if you're doing this right, it should feel like the deepest itch being scratched, that you're feeling blood flow return, you're feeling tissue soften, so that you have full access to your position. And then you can work your way back up the spine if you need for one more little piece. But the goal here is not to spend so much time beating on your low back or mobilizing your low back that you can't absorb the changes. Get a dose, and get a response. We'd rather if you're doing this for pain or to improve your position, we'd much rather have more frequent little doses than massive epic sessions.